Hi, I'm Dana Sampson from the National Institutes of Health, Office of Behavioral and Social Sciences Research, or OBSSR. I'm joined by Patrice Nickens, also of NIH, of the National Heart, Lung, and Blood Institute, and we're here for a cardiovascular conversation. Welcome to OBSSR, Dr. Nickens.
It's my pleasure to be here for the Heart, Lung, and Blood Institute.
It's an honor to have this opportunity to commemorate National Wear Red Day. This year marks the 20th anniversary of OBSSR, having been established by Congress in 1995, recognizing the key role that behavioral and social factors play in the treatment and prevention of disability and disease. There are few examples more clear than heart disease. 1 in 3 American women die of heart disease and stroke. So fortunately, your institute, NHLVI, had the vision to launch a national campaign to bolster public awareness around women and cardiovascular disease. Can you briefly summarize the purpose of National Wear Red Day? What does this day mean to you?
Surely. So in 2002, the National Heart, Lung, and Blood Institute developed the Heart Truth Initiative. This is a public awareness campaign intended to educate the general public of the importance of heart disease as the #1 killer of women. So since 2002, the red dress has become a national symbol of an urgent wake-up call for women to take action and reduce the risks of heart disease. The day itself is a wonderful opportunity for sharing among community the message that of the importance of heart disease and how women and people that matter to them, their families, their sisters, their fathers, their brothers, their husbands, how we can work together to reduce risks for heart disease. And it's really wonderful to see a sea of red and people really taking pride in understanding how important not just the message of heart disease being a killer, but also empowering individuals to take responsibility for his or her health. Information and action can save lives. Since 2002, awareness among women for the importance of heart disease has doubled. Women now know their risks and can take action to reduce risks and prevent heart disease. Women are more aware of the signs and symptoms of a heart attack, and they know how to access urgent care.
Although cardiovascular disease is the leading cause of death for both men and women, gender gaps persist in mortality trends. A stubborn and unfortunate statistical fact is that CVD deaths for females have exceeded those for males each year since 1984. Are there any gender-specific programs at the Division of Cardiovascular Sciences to further prevention research?
The National Heart, Lung, and Blood's Division of Cardiovascular Sciences sponsored targeted programs such as the Women's Ischemia Evaluation Initiative, sex and gender differences in coronary arteries, as well as investigator-initiated projects. Finally, the NIH inclusion policy that require representative inclusion of women in clinical research is also important in keeping a focus on women's diagnoses, symptom presentation, prevention, and treatment in all federally funded projects. So this is such an important program because it allows us to focus on younger women who sometimes show, under the stress of pregnancy, evidence of diabetes or high blood pressure, and understanding how those early subclinical signs of disease can be used to understand and predict their risk for disease in the future.
The data does indicate a disproportionately high prevalence of cardiovascular disease in Black women. Can you highlight the 4 most known causes of high CVD prevalence in Black female populations?
Yes, so Black women or African American women have the poorest outcomes among women subpopulations. Women of color often have multiple risk factors which multiply risks. Among modifiable risk factors, Black women have high rates of overweight and obesity, physical inactivity, diabetes, and hypertension. Women also suffer high rates of poverty and under or no insurance, which complicates therapies. Healthy lifestyles such as regular exercise, normal weight, smoking cessation, healthy diets can reduce risks by as much as 80%. It's not easy, but we are worth this commitment.
There are also geographic disparities, with greater concentrations of Black female CVD in the southern United States. Are there any particular NHLBI initiatives underway seeking to address regional or minority CVD disparities?
Yes, so historically the Heart, Lung, and Blood Institute has used targeted programs to address minority cardiovascular disparities as well as regional disparities such as the southeastern part of the U.S. that have high prevalence of hypertension and stroke and very high cardiovascular disease death rates. There are examples of those initiatives include the Heart, Lung, and Blood Stroke Belt Initiative, Partnerships Program to reduce cardiovascular health disparities, programs to treat hypertension. Ongoing programs include an initiative on rural health, the Jackson Heart Study, and 5 centers or programs to reduce cardiovascular health disparities. Improving cardiovascular outcomes is the goal of these programs, but solving these problems are complex and underscore the need for healthy lifestyles, the bread and butter of the Heart Truth campaign. Nevertheless, communities need access to healthy foods, recreational facilities, and parks that are safe. We need to plan communities which encourage walking and biking rather than motorized vehicles for transportation.
Unhealthy behaviors account for a significant portion of CVD onset, such as sedentary lifestyle, diet, tobacco use, and alcohol abuse. In addition to behavioral factors, I'd also like to emphasize the key social factors which serve as prominent facilitators of cardiovascular disease. I think social support is a prime example. Studies have found that it can moderate the cardiovascular reactivity to psychological acute stress. It is also critical for depression recovery. So can you further describe the importance of women accessing support to foster proper adaptation to stress?
Yes, this is very important. Stress can exacerbate cardiovascular disease. There are multiple ways that you can reduce stress, and as you mentioned, outreach to social networking is an important way to release stress. But there are many ways. Meditation, breathe, take deep breaths, be present, slow down, tune into your body, decompress, laugh out loud. Laughing is a very important way that releases endorphins. Crank up the music, dance. Exercise itself is very important, not only for reducing stress, it improves fitness, and it can actually be a very effective appetite suppressant.
Pondering future directions for CVD research in women, I would personally be excited about expanding our epidemiologic data to include younger women, either through expansion of existing observational studies or creation of new longitudinal studies of younger women aged 20 to 40, but ideally in adolescence. I consider this an essential next step for improved CVD risk detection, as well as enhanced pathways to prevention. What do you think are the important next steps for identifying more accurate pathways to prevention and also improving risk detection?
Yes, well, Dana, I really enjoy your focus on trying to even earlier identify risks and subclinical disease for younger women. That's very important. However, I think genetics and the opportunity for precision medicine is increasingly important and offers the best possibilities for the future. Having said that, I still think that today we know the benefits of heart-healthy behavior, and a healthy lifestyle is available, it's cheap, and most importantly, it's effective. If you do this, women will live longer, better lives free of heart disease.
So Dr. Nickens, it's been such a pleasure having this conversation with you. Behavioral and social factors account for at least half of all premature deaths, including but not limited to cardiovascular disease mortality. This has become sort of the clarion call for behavioral and social scientists as we seek to improve our understanding of not only health behaviors, but also social determinants of health. So my hope is that along with biological scientists and also medical practitioners, that OBSSR's 40th anniversary can bear witness to the majority of American women living long, healthy lives through healthy hearts. So thank you so much for your time to celebrate this National Wear Red Day and promote ideal cardiovascular health in women.
Thank you so much.